Jaminan Kesehatan Universal atau Universal Health Coverage merupakan sistem penjaminan kesehatan yang memastikan semua orang menerima pelayanan kesehatan yang mereka butuhkan tanpa harus mengalami kesulitan pembayaran. Selain perlindungan risiko keuangan, konsep penting dari UHC adalah sejauh mana cakupan populasi yang terlindungi, sejauh mana cakupan pelayanan kesehatan dan tingkat cakupan keuangan dari paket bantuan secara langsung. Penyelenggaraan UHC di negara berkembang menjadikan adanya subsidi silang dari yang berisiko tinggi ke risiko rendah, dari yang kaya kepada yang miskin, dan dari yang produktif ke yang tidak produktif. Di Indonesia, UHC ditargetkan mulai berlaku menyeluruh pada 1 Januari 2019 dan dikelola oleh BPJS Kesehatan melalui program JKN KIS. Oleh sebab itu, dukungan pemerintah daerah terhadap UHC sangat strategis. Salah satunya dengan mengintegrasikan program Jaminan Kesehatan Daerah atau Jamkesda ke program JKN KIS. Integrasi Jamkesda merupakan sinergitas penyelenggaraan jaminan kesehatan bagi penduduk yang didaftarkan oleh Pemda dengan skema JKN KIS yang dikelola oleh BPJS Kesehatan. Hingga 1 Desember 2017, lebih dari 186 juta jiwa telah mendaftar menjadi peserta JKN KIS. Dari target mencapai 257,5 juta atau seluruh penduduk Indonesia pada 2019.
Ya, akses terhadap pelayanan kesehatan yang murah dan terjangkau seharusnya merupakan hak setiap orang. Tapi pada kenyataannya, apalagi di negara-negara berkembang, pelayanan kesehatan itu biasanya sangat mahal. Nah, hampir semua negara bercita-cita memiliki yang namanya Universal Health Coverage atau sistem kesehatan yang universal, ya, di mana setiap orang bisa mendapatkan akses pelayanan terhadap kesehatan itu secara gratis di mana saja dan untuk siapa saja. Dan Indonesia adalah salah satu negara yang mencoba menerapkan sistem Universal Health Coverage ini. Tapi ternyata tidak semudah itu saja, karena berarti harus ada subsidi dari yang kaya ke yang miskin misalnya, atau dari yang produktif ke yang tidak produktif. Nah, untuk melihat bagaimana cara terbaik untuk menerapkan Universal Health Coverage, ya, saya sudah ditemani oleh seorang yang sangat pakar dalam hal itu, yaitu Dr. Gro Harlem Brundtland. Dia adalah mantan Perdana Menteri dari Norwegia dan juga mantan dirjen dari WHO atau World Health Organization dan anggota dari The Elders, suatu grup independen yang mengampanyekan Universal Health Coverage. Beliau sedang berada di Jakarta. Halo, Dr. Brundtland. I don't know if you got all that, but I was introducing you. You were the former Prime Minister of Norway and also the former Director General of WHO. And of course, you are now an important member of the Elder, which is an independent group promoting human rights, justice, and of course the universal health coverage. Yeah. And you happen to be in Jakarta, Indonesia. Welcome. Tell us a little bit about your visit, the Elders' visit to Indonesia.
So let me say that after 2015, when we had been advocating sustainable development and to deal with climate change, we discussed which of the sustainable development goals should we now try to advocate specifically and have as one of our campaign areas. And after some discussion, we decided universal health coverage is a universal need. It is very important for human rights, which is one of our main obligations, yes, human rights, peace, and avoiding conflict. So we made the decision in 2016 that we will, for some years now, be working to promote universal health coverage. Then we have done a number of things already, but but one thing that we saw is Indonesia is a large country, yes, a large developing country, and it has health statistics which are not so good. They really need to improve. And you also have a president that campaigned and committed to universal health coverage in 2014. And he had, as governor of Jakarta, taken the initiatives he did to give the card to every person, etc. So we saw Indonesia as a good country to visit, to discuss the issues, to be supportive of the president's attempts and his commitment, and to do what we can to promote the idea and the implementation of universal health coverage.
And you met with President Jokowi himself and also several ministers, and we have now what's called BPJS. It's our sort of attempt at some kind of welfare system, and yet it's still a work in progress. And unfortunately, because Indonesia as a country, we're still developing, and one of our problems is actually getting the funding through tax. Taxation is also one of the problems that we're facing. But how do you see the way Indonesia is doing it when it comes to implementing the universal health coverage?
You already mentioned the issue of taxation. And definitely, one of the issues that we have been discussing with your finance minister, with your president, and with your health minister is exactly the point. The principles have been made, the commitment has been taken, but it needs to be funded. And of course, the principles are important, but as you implement, you need also the necessary resources to create a system that can deliver what you have promised. Now, that leads you to taxation. And there are many forms of taxation. Countries can have different systems, but one thing is clear. The level of taxation in Indonesia is too low.
It's very, very low.
It's 11% of GDP, which is, absolutely too low for a country that has ambitions to increase the social commitment for its people.
Over 250 million people we have now.
Absolutely. So this is one of the things that we have been discussing with the government and with the president. And I think they are aware of the importance of it, but it is also probably a complicated political process to get there. But I am sure that they are determined to move forward.
And we are, as a country, we've signed up to, we're committed to SDG, Sustainable Development Goals. We're also committed to Paris Agreement. Just to take it out of it on a sort of a global perspective, because you mentioned that universal health coverage or healthcare is not just about health. It's also about the economy. It's also about, justice, equality, and so on and so forth. And if we look at, for example, Scandinavian countries, amazing example of a welfare system that works, and also European countries. So, but what can we learn from developed countries, especially from what I hear, like in the UK, for example, the National Health Service, it's beginning to sort of having, cracks or problems arising because of just the nature of the complexity of this type of system.
The more advanced the system becomes, and the higher ambitions of treating every patient that needs it at the highest level, which is the case in the Scandinavian countries and in Britain, then the resources that need to be going into that area becomes quite large. But in Indonesia, given that you are a developing country, and that primary health care, community health, access for everyone to the basic needs, to vaccination, to care of mother and child during pregnancy, all of these things will really dramatically increase the health statistics of Indonesia and the destiny of mothers and children. So you have a long way to go before you enter into the kinds of problems of kind of luxury problems that a country like Britain or Norway could get into. Norway has a taxation level above 40%. Indonesia has 11%. So, if you had increased to 15%, there would be enough resources to really fulfill many of these ambitions. So there is a need. Now, we have mentioned tobacco taxation also to the President, because the tobacco taxation here is low. The smoking rate is terribly high, higher than in most countries. It's really a terrible situation, and it leads to more bad health statistics with regard to pulmonary affections, cancer, heart disease, even hypertension. So you need to get that smoking rate down. And that means policies have to be made. You cannot have a tobacco industry that still is allowed in certain ways to advertise their products.
Yes.
They shouldn't be able to.
Well, unfortunately, the tobacco companies, the argument is, they're one of our biggest, or big taxpayers, so there isn't that sort of incentive. I mean,
but they lead to so much damage.
No,
yes.
Absolutely.
So
they actually,
it's
a burden on the health system. But because you have countries like the United States, when it's still like
if we go to I said generally, but United States,
which you would think
bad
that they
example.
Would be a good
it's
example.
a very bad example. They have never entered into a real universal health coverage system.
But going back to raising the funds for it, especially, making sure that every one of the over 250 million people have access to free healthcare, it's the how. Now, the system we have at the moment is, paying monthly premiums, not much, but if for poor people or for poor families, it is an extra cost. What are your ideas on, is this sustainable, given the fact that we cannot raise enough from taxation?
I think it is necessary to raise more from taxation, because the best systems are those where you have access free of charge and where everyone is covered. So a solution that means poor people don't really have access because they cannot afford the payment of insurance, that's not a good system. So you really need to have some form of taxation that makes it possible for the government to guarantee people that their needs can be met. And this has happened.
Yeah.
It has been done in many countries.
That's right. We are now trying this, and it is an investment, but I think it's an important investment because we are investing in the health and the future of the people and
the
of
economy,
the country.
It's an important investment in the economy. It's not only right and important for people to be healthy, but it leads to higher economic growth.
Now, if we talk about universal health coverage globally, how universal is it now? I mean, are there sort of pockets where it's still, where access to health is still very much a problem?
Yeah, you can say that in the European countries, in the OECD countries, generally, there is a universal health coverage system that works. Then you have some examples in African countries, where Rwanda, for instance, Ethiopia, where they have come quite far in getting this kind of system in place. So some very poor countries have managed, and their health statistics have improved immensely. Then you have big countries, large countries like India, where the statistics are even worse than in Indonesia. And they spend much too little on the health sector. And the percentage of the GDP in India that goes to health is less than 2%. And this doesn't work. You have to invest in your people. And so, but then you have China. China had a terrible situation after they had the changes that happened in China in the 80s and 90s. They had a system. It was kind of abolished, and the health statistics became terrible But now China has changed. They have made central commitment to a universal health system now, and their statistics have improved very much. So you have many different examples. Thailand, which is close to you, has a universal health coverage system, and the health statistics have improved very much.
And of course you have countries like the United States, when
Yeah,
it's
then
still like
if we go to the, I said generally, but United States,
which you would
is a
think
bad
that they
example.
would be a good
it's
example.
a very bad example. They have never entered into a real universal health coverage system.
Because
And
especially
it
it's
means
becoming a political issue.
millions and millions of people are outside of the insurance system.
So what would you say are the biggest challenges for, I mean, ideally, you know, universal health coverage should be, because we've seen that the benefits and also the success, and it can be done very well. But what are the main challenges that countries face? For example, like you said, United States of America, it's not for lack of funding or anything. And then you mentioned like Rwanda very successfully changed. So what would you see as the main drivers or the biggest challenges in implementing this kind of thing?
First of all, you have to have a policy decision in the country that we are committing and legislating to have primary health care and universal health coverage. And then you have to finance what you have decided. And if you use 5% of GDP for health, then in most countries you are successful. That is enough. But if you try to have only 2.5%, it doesn't work. Now, and here in this country, you have public health expenditure through the budget of 1.1%.
Very, very low.
Very low. And the total expenditure is like 2.7%. Which means it's about half what probably is necessary. And then, of course, the expenditure is partly in private sector, so it doesn't really help the poor and those who are next to the poor to have good access if a lot of money goes through the private sector. So you need to have that commitment, and you have the legislation, and I know that you have in your constitution the right to health. But the implementation needs to happen, and you need to have taxation to make it possible.
Tell us a little bit about what we can learn from the success stories, such as in Rwanda. What did they do? How do they implement it so that they actually turned around the healthcare system?
Well, you know, I think in countries like Rwanda, which is really a poor country,
historically
you had few very rich people, and the general population were all then covered, and there was no strong private industry to try to fight the new system. Because in countries where you have quite strong private sector, there will be interests. Not only tobacco industry interests, but even hospital.
Yes, that's right. Especially there's lots of private hospitals.
Private hospitals that will be interested in trying to undermine a system which is more public. There's no question whatsoever. So a big chunk of the problems that you have to deal with here are people getting sick from tobacco consumption. And that is costly to deal with, you know.
How can the private sector be brought into this? For example, in Indonesia, I mean, one of the reasons why healthcare is so expensive is basically for those who can afford it, you know, and a lot of, many of the hospitals here are private hospitals because they know they're much more interested sometimes in making money and so on. But how to get them to actually also contribute, because this public-private partnership works for things like infrastructure building.
Yes, but I certainly think that a country like Indonesia needs to invest in a public sector effort, even hospitals, you know, because unless you have a public competitor to the private sector, it's hard
Yes.
to enforce. But the other thing is that policies can be made which make hospitals accountable on certain principles and certain rules that they will have to deal with the patients that belong to the poorer groups. So this can also be done. It has been done in other countries as well.
How?
It can
Through
be
cross subsidies or?
yes, in different ways, but also I think in a public debate like this, it's important that you know, even if thinking of tobacco industry, it was a strong opposition
Yes.
in the years that I was in WHO and worked on the Framework Convention on Tobacco Control to try to avoid the increase of tobacco smoking, certainly in the developing world, where the tobacco companies were focusing to sell their products because the richer countries had said no to them. No advertising, high taxation.
So that's why they
so
moved
they
to
moved to you
Indonesia.
and to other countries, and we had to try to stop them. But the arguments they used to avoid this convention were exactly the same that I hear here. Because tobacco farmers, this and that, no. But the drama is, tobacco is too dangerous to health that you cannot accept.
And it's been proven. It's,
there's no question whatsoever. So a big chunk of the problems that you have to deal with here are people getting sick from tobacco consumption. And that is costly to deal with, you know.
Unfortunately, the tobacco lobbying, because of corruption as well, you know, because the legislators are also very much influenced by the lobbyists. That's the problem. But Dr. Brundtland, how, I mean, the WHO has sort of committed to implementing this universal health coverage, and you being the former Director General of WHO. Well, what do you see as, I mean, how optimistic can we have universal health coverage by 2030, and how? I mean, and are they doing it the right way?
The how, first of all, you have to have public financing so that it can work. How do you get public financing? Through taxation. So those are some of the basic principles. And then in a country where you already have an established system that is different, you know, much private, not a full system, then the way you try to move to change that scenario into something that leads to universal coverage will depend on each country's history, what they have of resources. But of course, as I said, here, more community health and prevention needs to be secured. Otherwise, too many patients will go to the hospital or to the higher level health centers. They need to be
at the local level.
At the local,
we used to
with
have
good quality. I know,
with
and
the
then
Poshandu, and then but that's in the previous.
But you see, it needs to
regime.
be built up again. So in the rural areas of Indonesia, there has to be access to primary healthcare centers. Otherwise, the burden of disease will increase, and cost of the referral system will be unnecessarily high.
Yes, which is what we're seeing now. Everybody wants to go to the hospital just to have a minor, you know,
and this shouldn't happen, you know, because, but then you need to build up the system. And that has to be done by public money.
Yeah, but are you optimistic in the way that we are doing it, you know, will actually one day,
well,
or will this system, you know, at some point it's like, oh no, we've completely run out of money, because obviously somebody has to pay for it, and if, you know, like you said, now what we're seeing is a lot of people go to hospitals for ailments that perhaps before the universal health coverage, and maybe they didn't even have that, but because they felt that, oh, this is a good opportunity to take advantage of the system. So what would be the, you know, the future of this kind of...
So, no, you know, I'm hopeful that the reality of these challenges are known by the Indonesian government and the president, and that they will be moving to sort out some of the complexities. But one of them is moving to get some type of tax system which is accountable and controllable, so that people pay taxes. It's not, because 11% is of the GDP is not enough in any way.
It's very, very small.
So it needs to be done. Yeah.
So
and therefore, since I'm an optimist and since I believe that the commitment to the cause is real, then the steps that need to be taken will be taken in the coming years.
But what's the elders, like I said, they're campaigning this universal health care. What are you and your colleagues and the elders doing at the moment? And
well, we have made our elders, we have clarified our elders' positions, and I have mentioned a couple of them to you now. There needs to be public financing in order to achieve universal health coverage. And so we are arguing, based on the experience across the world and based on what both the World Health Organization and the World Bank already know. We work with them, and we choose to advocate in the directions that can help move most countries in the right direction. So we were called by Nelson Mandela to work for human rights and for peace and to overcome conflict. So we are trying to do this in this area.
And health is very important.
Health is a human right, as is education, by the way.
Okay, Dr. Brundtland, thank you so much. And this is not your first time in Indonesia. No. And the first time you were here was, you know, when this was a different world back in the
30 years
80s.
ago.
Just very quickly, how do you find Indonesia? How are we doing?
Well,
because we're now one of the largest democracies in the world.
It's a big change. So when we came here 32 years ago, my commission on environment and development, we couldn't have a public hearing, they said, because you were not a democracy. And they didn't want to hear bad news. But we said, well, then we're not coming. And they opened the doors. We were able to have a public hearing. So we felt we were contributing by coming here, opening up for people to be able to discuss important, you know, environmental and health issues at that time. So that was my first visit to Indonesia, but I've been several times meeting with several of your presidents over the years. And I've seen the changes. I mean, Jakarta, with all the tall buildings, etc., it's very different from the Jakarta I saw in 1985.
Yes, absolutely, both physically and also just the sheer number of people we have. Again, Dr. Brundtland, thank you for coming here, and I hope your presence here and your colleagues' presence here from the elders will sort of add more sort of optimism towards the government's effort to implement universal health coverage, because I think, you know, it's a very important step also in order to closing the gap between the, you know, the poor and the rich, and they're just getting
equality.
Yes, it's a question of equality.
Thank you so much.
Thank you so much, Dr.
Thank you.
Thank you. Ya, demikian bersama Dr. Gro Harlem Brundtland, ya, mantan Perdana Menteri dari Norwegia dan juga mantan Dirjen dari WHO. Setelah ini jangan kemana-mana dulu, Insight akan kembali dengan salah seorang anggota dari The Elders lagi. Siapa dia setelah yang berikut ini? Mexico is also very much like, I mean, it's a big country like Indonesia. But does Mexico have a universal health coverage
Mexico
now?
also subscribed to this objective, and we have been working for many years.
Ya, menerapkan sistem pelayanan kesehatan yang universal bukanlah hal yang mudah, apalagi bila negara itu merupakan negara yang masih berkembang dengan jumlah penduduk yang besar. Nah, apa-apa saja mungkin yang perlu dilakukan untuk bagi sebuah negara untuk menerapkan universal health coverage yang baik. Saya saat ini sudah ditemani oleh Mantan Presiden Meksiko, Ernesto Zedillo, yang juga saat ini merupakan salah satu anggota dari The Elders, kelompok independen yang memperjuangkan hak asasi manusia serta perdamaian, termasuk juga universal health coverage. Very warm welcome to you, President Zedillo. I was just saying in my introduction, you were the former president of Mexico, and you're also a member now of the group The Elders, currently in Indonesia as part of campaigning for universal health coverage. And how is that working out? I mean, are you excited about being part of this campaign? And why is it so important to campaign for this kind of thing?
First of all, as elders, we are very pleased that this objective of universal health coverage was incorporated as one of the Sustainable Development Goals. We decided as a group that if we were going to choose one of the Sustainable Development Goals for which we would want to be strong advocates, it should be universal health coverage. So that's the start. And now, as part of our advocacy, we want to go to countries that are already committed to do it. And we want to see how they are doing it, what are the challenges, what is the progress. And we thought that Indonesia would be a good place to be. Why? Because even before this objective was adopted as a sustainable development goal, Indonesia had adopted it. You know, in fact, in the late 90s, after the financial crisis, you put it in your constitution, the right to health. And then little by little, but very consistently, you have been building a system to make it a reality, particularly since 2014, when you started this effort to incorporate more and more people, but particularly poor people, into the system. So that's why we are here, to know about the progress that is being done, but also to know about the problems and the challenges that are being faced. But
and we have a lot of problems and challenges in trying
to... you know, you don't build something as important as universal health coverage in a few days or in a few years.
It takes time.
It takes time, it takes effort, it takes vision, it takes leadership, and it takes a lot of resources.
Yes, such as, you know, funding, you know, or who's going to pay. Right, let me ask you a little bit about Mexico is also very much like, I mean, it's a big country like Indonesia, but does Mexico have a universal health coverage
Mexico
now?
also subscribed to this objective, and we have been working for many years to extend health coverage.
How extensive is it now?
I mean, we would say that basically all the population has access to some form of health services. But of course, we have a lot of variance. You have people who had very good services, and then you have people in the rural areas who have access to rather modest services. So this is a work
but how long has it been sort of the attempt to have some kind of universal health
for
coverage?
many decades, we have been building various health systems in the country. And this may be a problem when you have different systems. We have had a system for, let's say, unionized, organized workers in what is called the National Social Security Institute. And for many years, we have been building what we call an open system for people who are not insured in the other formal systems. And this latter system, the open system, has been growing, you know, for many years. But I think what is interesting about Indonesia is that you really are trying to consolidate everything into one system with different kinds of providers, because you have public hospitals, but you also have private hospitals.
And we have employer coverage as well.
Exactly. But I think you have a holistic view for the system, which I think is very important if you are pursuing universal health coverage, because then you have real universal insurance. You are able to pull risks into a big system. When you start fragmenting the system, then it's very hard and very costly to provide services for the poorest people.
Especially since our ability to create or generate revenue from taxes is very, very low at the moment. That's one of Indonesia's main problems, and that's why at the moment our system still relies on the payment of premium, for example, and that's
yes,
which
but
has
I think,
its own drawbacks.
the steps that the government has taken to make part of the system millions and millions of people that have now the right to go to clinics and to receive medical services rather sooner than later will make it clear that the government needs to increase revenue to pay for that.
Yes.
Because you cannot take, an existing system that was made for much less people and make it work for many more people.
Many more people are prone to diseases because we also, have a lot of health issues here in Indonesia.
Yeah, well, but you need to solve them through the medical system and to the health system. But I think this is a good cause why the government can call upon people to contribute more for this endeavor.
Well, at least here we have a good political will from the government in trying to make some kind of universal health coverage in order to close the gap between the rich and the poor. The world can see universal health coverage in
Well, no, actually, watch out. In Indonesia, the objective is 2019, okay? So you don't have 11 years to, the commitment is to achieve it faster.
Let me just ask because now you're part of the elders and you're the global citizen, as you reminded me, but how important is universal coverage when it comes to promoting really the other basic fundamental rights that as humans have, whether it's your living in peace, right to prosperity, right to just basically all the good things in life. Where does health coverage come into it?
Well, I think it's very important. I think citizens expect from the state, of course, number one, security, the protection that their human rights will not be abused by the state, first and foremost, but also that other people will not threaten their personal security or their patrimony. So that's very important. Then I think citizens expect the state to make sure that everybody has access to education, whether you are rich, but more importantly, whether you are poor. You expect the state to support you to get education for your children. And the other important thing is, of course, health, because without health, it's very hard to do anything else in life. So in a way, education and health go together. And this has to be ensured since very early age. This has been the experience of every country. You can have, for example, access to education. But if children are with bad nutrition and also with bad health, even if you have the school, you have the teacher, you have the books, you know that the children will not really attend a school or they will fail in a school. So education and health must go together.
Unfortunately, what we're seeing now in the world is increasing inequality, even in developed countries, and economic equality, and what we the 1% versus the 99%, and it's a phenomenon which is global, and it's not being addressed properly. Now, how are you concerned about this? Because a lot of the
I think there are two facts.
Yeah.
One fact is that income distribution for the world as a whole has improved dramatically in the last 20 years. Why? Because a lot of people who used to be poor are no longer poor.
They've gone up a little bit.
Yeah, and those people come from developing countries. So if you were going to look to the world as a whole, then you will notice that income distribution has improved. However, in some countries, particularly developed countries, income distribution has deteriorated. Inequality has increased. And one of the reasons it has increased because education and even health is very poorly distributed. In many developed countries, only if you have money, you get access to the best education. Only if you have money, you have access to good health services. So I think if rich countries in the north want to continue being rich and powerful, they should care more about the education and the health of their citizens. And that's our big challenge in developing countries. The only way we have to continue making progress is by making sure that our population is better educated and has better access to health.
And the other side to health is the quality of food. For example, obesity is now increasing, even particularly among, say, the poorer people. We see that more and more poor people have access to nutrition, which is actually very bad for them, and this also impacts on the idea of universal health, because the universal health coverage, once you're sick, it's very expensive.
Well, that's only one issue. You know. In a way, it's a consequence that we are not as poor as we used to. Now, per capita, people are eating, per person, eating more than before.
Having more and more complicated diseases like diabetes.
So one thing goes with the other. We eat more, and we don't exercise. We don't do physical work as we used to do, and therefore you have the problems you are describing. And that is why it is important to spend not only in curative medicine, but also preventive medicine. That is very important, to give people enough information so that they can have, yes, certainly more nutrition, but better nutrition. I think that's quite important. But problems are not only related to overweight. I think in Indonesia we have to speak about issues like smoking.
Yes.
Tobacco consumption.
Guilty. And also because a lot of the tobacco companies that once existed in developed countries have sort of moved their businesses here and selling their products here.
And I think that's unacceptable, that they do things in countries like Indonesia. They do things that they are no longer allowed to do in developed countries. Right?
That's right.
And I think international companies should always be expected to behave well in their country of origin, but also in other countries where they are working.
Yes, absolutely, definitely. Smoking is something that Indonesia, unfortunately, the argument is because we have tobacco farmers, and and it's an income or tax.
But there are other things that can be cultivated. There is something like crop substitution.
Yes, You have to basically...
And even things of higher value for the farm.
Let me go back to this idea of the universal health coverage, and also we have a target for 2030 sustainable development goals. Now, you know, health care, and it's very, very expensive. And you can't afford it, basically, like here in Indonesia. You get very poor service if you can't afford it, and the health is something that the rich, you know, can afford, for example. But at the same time, what are we doing when it comes to educating on the prevention, you know, just teaching lifestyle to keep healthy, to be healthy, and at the same time we are very much dependent on food producers that produce all these mass products that are actually really, really bad for you, you know, like the sugar companies or the whatever stuff that we eat, and these are all
I think
the economic forces that actually influence.
Has to look after the public interest, and this is what we have seen in developed countries, even developed countries where the belief in the free market is almost absolute. But they recognize that the free market must be helped to do the right thing, and that is why governments exist, to regulate and to look after the public interest. And of course, the first step is to inform the public. You know, every time you eat something that comes in a package, the public should know what is in there. And if there is something there that is not good for your health, it should be in a bigger letter so that you notice that.
Particularly in the case of Mexico, the correlation between, you know, better healthcare system, better access, more universal coverage, has it actually made tangible positive impacts on whether it's increasing the economic growth?
Well,
or
I think we have the two stories. You can see an improvement in life expectancy. You can see a decrease in infant mortality. You can see a decrease in maternal mortality. I mean, you can see all kinds of good indicators. But also you can see that we start to acquire the diseases of richer countries. Mexico, unfortunately, has now overcome the United States as the most obese country in the OECD, which is terrible, because that has consequences on diabetes and many other things. And that's, so we need to do more on preventing that and on, frankly, regulating part of the food
This is something that the current government is aware of? Are there public education?
Well, they are totally aware. I mean, and they are working on it. Whether what is being done is being effective as soon as we need, that is a question in the air.
Yes, because now we have here in Indonesia, we have both, you know, the traditional, the tropical disease, or you know, the communicable disease, but at the same time we're also facing, you know, an increasing cases of type 2 diabetes and heart problems and so on and so forth. Just very quickly, just to put a wrap up to our discussion, 2030, it's not that far away. I mean, time flies. Do you think that the world can see universal health coverage in 2030?
Well, no, actually, watch out. In Indonesia, the objective is 2019, okay? So you don't have 11 years to, I mean, the commitment is to achieve it faster.
For the actual, the coverage itself, but when it comes to...
Well, you know, I think it's demanding, but I think many of the sustainable development goals can be achieved as it has been agreed. When the Millennium Development Goals were established back in 1999, many people thought that they would not be achievable. Now, some of them were not really achieved, or some of them were not achieved in some countries. But overall, the record was quite good, particularly in reducing the number of people living in extreme poverty. So I think we must be confident that it can be done, but at the same time, we must be willing to make the effort and to establish within our countries the right priorities.
Yes, but I'm glad to hear that you're optimistic, particularly about Indonesia. And let's hope that we can achieve it by 2019, providing every single
I think you are taking very important steps. I can sense not only the political will, but I can sense that the government is engaged, trying to do the things that need to be done, recognizing that they have very serious problems to overcome, acknowledging that more resources are needed, and definitely they are not, let's say, playing down expectations. I mean, because sometimes governments launch an objective, then realize that it's hard, and they start to be quiet about it.
Yes, absolutely.
In this case, it's not happening, you know.
And in the meantime, we all have to do our part, which is remain healthy, make sure that, you know, we exercise and eat the right food and
pay your taxes.
And pay taxes.
Pay your taxes and make others, you know, because if you pay your taxes, which I'm sure you do, then you want others to pay taxes, because it's not fair that some people pay taxes and others just don't do it.
Yes, and also we have to make sure that when we do pay our taxes, it actually goes to where it's supposed to go and not being whittled away and being corrupted away.
Absolutely.
President Zedillo, thank you so much for your insight. It is a great pleasure to have you here, and you know, I wish you every success continuing the good works that the elders are
Thank you so much for this opportunity, and thanks to your beautiful, incredibly wonderful country for receiving us.
Thank you. Ya, demikian insight kali ini, dan memang yang namanya pelayanan kesehatan universal bukan sesuatu yang mudah, tapi tentu saja sebuah mimpi yang semua kita harapkan dan bisa dilaksanakan semakin cepat, semakin baik, karena kalau kita bisa menerapkan universal health coverage, itu dampaknya akan bisa sangat positif terhadap pembangunan dan perkembangan negara ini, termasuk tentu saja dari segi ekonominya dan sosialnya. Terima kasih, saya Desi Anwar, sampai jumpa, bye-bye.